There you go, your ID. Thanks. I like it. All right, it's just us. We've got it open now, and we're also recording it. So if people can't attend, as many people, we can always send it to them. Oh, here comes some folks. Great. Hi, welcome everyone. Hi, everyone. We're going to give it a minute and I'll introduce myself and we'll get started. So thank you for joining. Okay. Well, good afternoon, everyone, on this rainy May day. I'm Katy Gaul-Stigge, and I have the honor of being the president and CEO here at Goodwill, New York, New Jersey. And it's a really important Good Talk today because it is Mental Health Awareness Month. And I even have a note here somewhere that says it's maybe Mental Health Awareness Day. And we are talking about mental health, stopping the stigma, and the work we do here at Goodwill to make sure that no talent is left on the sidelines and that everyone is able to participate in work and connect to the power of work. So if you've missed any of the previous Good Talks, I do hope you check them out. They're on our YouTube channel. And we've talked about mental health. We've talked about our work with individuals with disabilities. We've talked about unemployment and what we do to combat that overall. So we do a lot of things here at Goodwill. So I hope you can learn even more. It's spring. And so I can't help, it may not feel like it a little bit today. It's a little cloudy, but I can't help but remind you that it's also spring cleaning time. So if any of you have any donations that you are thinking about bringing, we'd love to have them. It's a great time to donate to Goodwill. And our stores, like the clothes that I'm wearing and this cute necklace that I got, are all from Goodwill. And what that does is that, is the engine that helps us power the work that you're going to hear about today. We collaborate with a lot of partners, and one of them is our donor, and our stores that help us repurpose over 59,000 metric tons. 40 million pounds of clothing and goods, which turns into 59 metric tons of that are not of CO2 not released into the atmosphere, meaning that because we repurposed it, we were able to keep that carbon from being released, which is very important. So if you didn't know about that, now you know, and I hope you're going to learn a lot today. See here, I just want to tell you that, again, today's talk is about May is Mental Health Awareness Month, and today we'll discuss how, whoops, sorry. The camera, that's my fault. Today, we'll discuss how Goodwill positively affects the lives of persons with mental health conditions and why this is important. We really believe in what a hashtag that you may have seen out there, which is called Stop the Stigma, which is all about ending stigma with mental illness, really about seeing the whole person and making sure that we all work together for that. So I've invited two very important people. One is Carline Dalton, the first person to speak, our Senior Vice President of Behavioral Health Services, and she can tell us how our critical behavioral health services impact the lives of individuals with mental illness. And she's also she's been with us for over 25 years, or she's been in a career for over 25 years. She's been with us since 2013, very proud, and she keeps getting promoted. So way to go, Carline. She's a wonderful leader. And in fact, has won an Excellence in Nonprofit Management program at the Adelphi University. So thank you, Carline. It's always great to work with you. The mission of Goodwill is to empower people with disabilities and other barriers to employment to gain independence through the power of work. So why don't we start? We were talking about this a little bit earlier. What's the difference between behavioral health and mental health and mental illness? And who at Goodwill do we target? What are kind of the nuances here for those of us that are not, a therapist or a social worker, or a doctor? Tell me a little bit about who we're talking about here that we serve at Goodwill.
Absolutely. Thank you, Katie, for having me. I'm excited to be joining. Like you said, it's Mental Health Awareness Month. We can't say that enough. We got to get the awareness out there. So we have 6 behavioral health programs here at Goodwill, and who we serve are individuals who live in our communities who have serious mental illness. And what that means is that they have disabilities that impacts their ability to function in daily life. So someone with a serious mental illness may not be able to go to work. They may have symptoms that prevents them from getting out of bed in the mornings. These are people who got ill at a young age, and it disrupted their education. It disrupted their ability to engage in regular social activities, right? So if you got ill when you were 19 and it caused you to drop out of college, you never got to experience dating. You never got to experience developing relationships. You never got to experience that opportunity to try different jobs and see what works for you. And so when we talk about serious mental illness, we're talking about a disability that's really impacted someone's functioning in every aspect of their life. And that's different from someone who may be, if you're 40 years old and you have to go through a pandemic and you get depressed, right? That depression is because of something that's occurring at this point in time. And it may not continue for the next 20 years. You maybe be able to get services, get some help, and go back. Hopefully not, yes.
I mean, I know that I have here that 41% of adults in the US report at least one, behavioral health condition. And that I know we keep hearing that people of color and people that are younger, especially our youth, are really suffering right now with behavioral health conditions. But what you're talking about are people, who include that, but really who, what I'm hearing, have a very serious interaction with the with the hospital, with maybe serious medications, that kind of thing. So while a lot of us experience, or, due to stimuli, a grief event or, a pandemic, or something like this, that we need some this is somebody with a, as you're saying, a disorder. So this is, a smaller group of the population, but we're all in this together and we all want to, fight the stigma together. Now, I can imagine that if I had this serious diagnosis, or my sister did, or someone, in my community, I might be more focused on getting healthy than a job. So tell me, how does getting a job fit into what we do at Goodwill?
Absolutely. I think we help people to look, we try to work with people from a holistic perspective, right? We want to help them. We want to support them around socialization, learning to manage and care for themselves. We want to help them with their medications, getting on a good medication regimen to address the disorder itself. But also we want to help them be able to engage in community, to engage in work or school. And so that's how it then brings us back to employment, in that as people get well, as people start to be able to manage the symptoms of the disorder, as people start to work on those social activities, people then start to think, okay, I'm starting to feel good. I want to be productive, right? I want to be part of the workforce. I want to give back. And so that's also where we would then come in and continue the services around helping people to then discover what their work goals are, finding those jobs and then maintaining the job, because there's a lot of work, as Miguel's going to tell us soon, in getting them the job, but then there's also a lot of work in then maintaining the job, especially if you haven't worked in 10, 20 years and you've been in institutional care for any significant period of time.
Yeah. So what kind of services at Goodwill do we have? Can you tell us a little bit about, one of the things I really like, and I always say when I go out to visit your programs or our programs is, I like the approach. We have a lot of, it's a non-medical model, meaning that, we're not talking about, let's put you on more medicine. We're talking about the whole person. And so what are the kinds of services that we provide? And tell us a little bit about them, just so people might know. Because if you have any community members who are out there listening, we take referrals, we bring people in, and we'd love to serve anyone that is interested in that, that we can help. So why don't you tell people about who we serve, what the service is that we provide?
Yes. So like I said, we have 6 behavioral health programs. The programs fall into different categories. We have clubhouse programs. They're accredited clubhouse, meaning that they're recognized by an international board that it is that we're doing the work of the club, that we're being consistent with the model of the club. We also have 2 PROS programs, which stands for Personalized Recovery Oriented Services. It is a comprehensive treatment program where people can work on the medication management, learning the opportunities for socialization and learning the skills, as well as going back to work, and all of the other things, including wellness and things like that. And then we also have the peer advocacy program. It is staffed by individuals who themselves are people recovering from mental illness, and is now able to serve as a role model to others who are just starting or in the midst of their journey of recovering from mental illness. And so with that, we help people, we support them in recognizing that there are things that they could achieve in their life, and the peers serving as the model for that, helping them to figure out what's the next step, what is best for them, how to advocate for themselves, right? How to ask for what they're wanting, how to talk to their psychiatrist, how to apply for benefits that they may qualify for. So we're doing that as well. And then the last program that I didn't mention is our ACE program, which is our employment program. That's strictly all they do. So they assist people who are wanting to work in developing resumes, in developing the interview skills that it takes in order to get that job. And then again, finding the job and maintaining the job once that happens.
Well, thank you, Carline. I would love, Miguel is here. He is a wonderful member of our team here at Goodwill. And we wanted to also bring a young man named Kyle to the conversation. Unfortunately, there was a family emergency this morning, but we are going to talk for Kyle. But we want to talk a little bit about what you do in ACE and use Kyle as an example, Miguel, if that sounds good today.
Absolutely. Katie, thank you. And Carline, thank you as well. A little bit what we do in the program is we actually meet participants where they're at. So some participants are ready to go on an interview and ready to start working. Unfortunately, not everyone falls in that category. Some are in the phase of creating a resume. Some are learning how to apply for, so we meet them where they're at. So wherever they're at, we tend to start there and build from there and proceed forward.
That's great. So we're just going to use, we've got this wonderful young man who's really a success story. He is currently working at Stop and Shop at a job that he loves, but let's go back a little bit, just as an example, who is this young man, who is he, what's his diagnosis? How did he come to Goodwill, and why was he looking for actually a new job? He had a job when we met him, or he has worked, as most people have, but it wasn't working out, and now he's in a new job. But I guess I've kind of revealed the whole story there, but I know. I guess I'm not a good interviewer. So let's start at the beginning, though. Why don't you just tell us a little bit about how you met Kyle, what relationship you guys had, and then what problem were you trying to solve with him?
Sure. Kyle was referred to us, and the reason Kyle came to Goodwill was to obtain better employment. As you mentioned, Kyle was working. His commute on a daily basis was 4.5 hours on the MTA. Horrible. And Kyle has a family, has a beautiful 8-year-old daughter who he cares about and tends to, like he should. So Kyle was referred to us, and he needed better employment. Maybe a job working closer to home where maybe he's going to have more time for family and for social events. Because 4 hours on anything, that's another job actually. So he's riding trains for 4 hours. So we started working together right after the pandemic, where we still were actually working remotely. So we just started from the very beginning. You know, I went over his resume. We did mock interviews over the phone through FaceTime. We revamped his resume together. And I started assisting him in applying to other employers. Now, Stop and Shop, they were having a big event, a very big event, which they got over 800 participants at this event to apply. And they were interviewed that day. So Kyle, the man that Kyle is, and he has goals, and he really wants to be successful. So that day, he didn't tell me, but he went to 3 locations that day and applied. And can I tell you what? At the end of the day, all the managers wanted to hire him. That was amazing. So the interviews went well, and he picked the Stop and Shop location, which was closer to him.
Makes sense.
So and then he just like a rocket ship. The first 2 weeks there, they actually placed him in the union. I was very surprised to hear this because, as you know, Katie, it takes 90 days before you can even get into the union. Kyle was placed in the union after 2-3 weeks. And also, it didn't stop there. His second month on the job, he was awarded Employee of the Month.
Sounds like he's doing great. I mean,
I was speechless. And Katie, it doesn't end there.
What?
There's a lot more going on because he has a good personality. His social skills are up to date, up to par. His manager, he works for the meat department at Stop and Shop. After the Employee of the Month, they actually approached Kyle and said, "Hey, have you ever thought about becoming a butcher?" He's already getting promoted, and it's only his
training and promotions. That's great.
And he's very pleased. He loves his job, and he loves his coworkers. And he hasn't missed a day. He was hired December 30th, December 29th or the 30th. He was hired first day on the job. He hasn't missed a day of work. Wonderful. And his hours have multiplied. So he is extremely happy where he's working 5-6 days a week, and he's doing extremely well, Katie.
That's wonderful. And what do, Miguel, as someone who's working with him, it sounds like this guy, Kyle is doing well. You were able to help him overcome this commute and sort of prioritize what was important. But what do you do now when someone's working? He does have a mental illness, but it's not slowing him down. What does Goodwill do to continue to support him and help him achieve these goals?
Our priority when participants come to the program, they're categorized in a job search mode. So everyone that comes in, that is priority to obtain employment. Now, after employment, Katie, the actual work for the employment support specialist, myself, turns into a retention support specialist to assist them while on the job. So that's
great. So he's still, he can still count on you and ask you questions and see how you can support him while he's, navigating the world of work.
Yes.
We all can use that.
Mm-hmm. And if I can just add it also, one of the other things that we can do and do is then help people look for better opportunities. And so it's so heartwarming to hear that, there's conversations where he could probably expand his career and become a butcher as opposed to just someone who works in the meat department. So that's
great.
also
Yeah.
part of it.
I mean, we're always saying that we don't want to leave any talent on the sidelines. And when we help support someone to get into work and then grow in their career with an employer, either training within the employer, training outside of the employer, we know that folks can really thrive and grow. Now, I do have one interesting question here, Miguel. It says here that you've never met Kyle in person and that we've been doing all of this, some of this remotely with him. What is it like to provide services in this new environment, social work, social services? Really think of it as a face-to-face work, but here you are doing that. What's that like for you? What's that like for Kyle? And tell us a little bit about how you guys pivoted during this time. And obviously now we're back in person. We're here in the office, all of us, but tell me, and maybe it's convenient. Just tell me a little bit about how you pivoted, Miguel, and how this worked.
Okay. I'm going to be honest. It's not, I didn't think this would actually work, and maybe we'll be able to help our participants. We can't see them. We don't have an image. Sometimes we go by a picture that may be available to us. So at least we can see some human features there. But yeah, working remotely it's not a piece of cake. But if we build trust, and this is how I see it, if we build trust in the beginning, you can accomplish anything. And I think this is proof with Kyle himself, as far as this success story, where I never met Kyle in person, but he saw, you can tell when someone is genuine about their work. And that's important. That's important because anyone, they can see if you really care or if you're doing the best you can for them. Mm-hmm. So I think I showed that to Kyle, where I was genuine, and that's where the trust began. So as the trust builds, you can actually accomplish more things. And just to a long story short, Kyle picked up, and our relationship grew, and he trusted me. And he accepted my suggestions where I said to apply, not to give up. One door closes, two open, and just continue. And Kyle, he took that and ran with it and hasn't stopped. So Katy, to answer your question, Bess, is we have to create trust with our participants. That's actually a must.
I love that. I mean, I think we get that. I mean, I believe we serve, here at Goodwill, I don't know if I said this at the beginning, but we serve over 10,000 people in our different areas of focus, where again, we're trying to really move the needle on employment for people. And there's over 900 people like Kyle that we serve in the programs that Carline told us about. So this is just one story that really highlights the kind of trust that Miguel's building, that our teams are building, and the belief that we have in that everyone, that we want to stop the stigma, don't leave anyone behind, see them as a diagnosis. We want to see everybody as a whole person. So someone raised their hand, which I really appreciate, but I don't know how to call on you because I don't usually use this. So if you could go into the chat, William, who seemed to have raised your hand, I appreciate your hand raising and your question. That would be awesome. So then we can ask your question. And anyone else maybe in the chat, if you have any questions for us, Goodwill, about anything really, behavioral health, any of the areas that we have, but especially today in our mental health awareness month. So, or maybe that was it. Maybe sometimes people just press a button accidentally and they raise their hand when they were trying to mute. But anyway, I hope, oh, here we go. Oh, and this is one of our team members. It's saying at ACE, we make ourselves available to our participants to meet face to face. Yes, thank you. Good point. We're not all remote all the time. It really depends on the participant. Thank you for clarifying that. Yeah, we don't want to let people know if you're interested in coming, because what I want to tell here at the end is two things. One, if you're a company that's looking for qualified talent, you should email us at findgoodpeople@goodwillny.org, and we would work with you. We even come up with customized training solutions, and or I believe that the Stop and Shop where you're talking about, they had a hiring fair. We were able to help drive people to that hiring fair, amplify those things. So happy to do that. And then if anybody is interested in learning more about employment or behavioral services, if you yourself, your community member, your cousin, your sister is interested in any of these services, please email us at services@goodwillny.org. And if you want to come on a tour, if you're like, wow, this is cool, I'm enjoying this Zoom, but what I'd really like to do is meet Katy face to face, and meet Carline and meet Miguel and meet them in person, and come see where we're doing this awesome work in the Bronx, in Brooklyn, in Manhattan. We have regularly, we're putting together tours, which we love to do. I love coming out and seeing everybody. And you could email us at development@goodwillny.org if you're interested in coming on a tour with us, or if you want to do a company-wide volunteer event, all those kinds of things. We do all of that. So I'm sorry that we couldn't see Kyle today, but I do feel like Miguel did a great job telling us about him. I got a sense of him. I got a sense of really the transformation that's happened here with addressing the core problem, which was a too long commute away from your daughter, and finding work and supporting and retention that job that can allow for successful and connecting to that power of work, which can really translate into more and more success for Kyle. So happy spring, everyone. And we will see you at the next Good Talk. And maybe we'll see you even before that if you're interested in a tour or coming to see us. And we also hope we see you donating your clothes sooner rather than later. And we'll talk to you soon. Well, thank you so much.
Thank you.
Bye.
Bye.
Thank you, guys.
Thank you, Miguel.
Bye.